So in this video we'll be covering the basics of health and methods of disease prevention. The first chapter in SPM. So first of all you need to know the definition of health. So WHO defines health as not merely the absence of any disease but the complete physical, mental, social well-being of a person. So this includes a new dimension to health, which is the social and mental aspect, which is usually neglected in the previous decades, but there's a lot of awareness happening in that aspect now. Now to measure health, there are it's known as quality of life index. There are two variables which they usually use. One is known as the human development index and the other one is the physical quality of life index. So they have different factors based on which, like your life expectancy, your diseases and different rates, and all this put together they will give one number used to compare different countries. So that will be the basics of health, and then you need to know the indicators of health. So the indicators of health can be divided into mortality indicators and morbidity. So mortality is in any case where a death occurs. Morbidity is where any insult occurs but no death occurs. So the different mortality indicators are your crude death rate. Crude death rate is number of people dying divided by the number of population under survey into 1000. The life expectancy, that is average lifespan of a person in a specific area. Then infant mortality rate, child mortality rate. So child is basically anyone over 1 and less than 12 years. So 12 to 16 will be your adolescent, and uh, si- above 17, 18 all would come under your adults. And then under 5 mortality rate and your maternal mortality rate and your disease specific mortality rate. Of all of these, your infant mortality rate, your under 5 mortality rate and your maternal mortality rate are very very important, and you might have some problems which you need to solve based on the formula. And always remember, rate is where you compare something from a whole. For example, crude death rate is number of people dead per whole population. So it's like that. And ratios where you compare two unrelated things, like your gender ratio, the ratio of men to number of females to 1000 men. So those things, that's the difference between rate and ratio. So whenever they see something like ratio in SPM, the formula would be like a part of it divided by the whole population into 1000. Okay, so that is something I wanted to mention. So moving on, morbidity indicators would be your incidence and prevalence. Incidence is the total number of new cases present during a particular time, and prevalence is number of active cases which might occur before the time which you start taking survey all this. So prevalence uh, will give you an idea of how prominent a disease is present in a place, whereas incidence will help you to understand how a disease is spreading or how it is growing in one region or something like that. So, and your hospital occupancy rates, your duration of hospital stay, and your spells of sickness, all these things are your morbidity indicators. So your socio-economic indicators. So I didn't talk about the dimensions of health, and there are just pages of text in Park which are like repeated uh, things, and they just keep including a lot of unnecessary information. Like they split that social part into your work life, your personal life, your family life, your spiritual life, your and they just come up with stories and stories, and I think we can do that on our own. I don't want to waste time talking about that, and we'll talk more of useful things which we actually need to remember. So coming back to social economic indicators, the various indicators are your housing, family size, literacy rate, your availability per capita calorie, your GNP, your growth rate, your unemployment level, and your dependency ratio. So all these are your socioeconomic indicators. You need to know in detail about each of them. So, and finally, I would like to finish off with this disease prevention. So there are four levels of disease prevention, the primordial, primary, secondary, and tertiary. We'll make it very simple to remember. Primordial before risk factor comes. Primary, reduce the disease. Secondary, reduce the presence of disease in that person. Tertiary is reduce the damage. So that I hope that helps you remember it better. And you need to know the modes of intervention in each of these. So the primordial modes of intervention will be your individual education and mass education. Your primary modes of intervention will be your health promotion and specific protection. So this is a very favorite question. You, what are the modes of primary intervention? So you need to talk about education, awareness about various diseases and how you can tackle it with simple diet and lifestyle changes. Specific protection in case like you can talk about vaccines and contraceptives and various other things which we use to prevent getting the disease. And then the modes of secondary intervention are your early diagnosis and treatment for suspected cases. And finally, your tertiary level of prevention modes of interventions are your disability limitation and rehabilitation. So this is a very brief intro into your SPM, covering the chapter concept of health from Park. So I hope it's very concise and you remember most of whatever I said. Thank you.